Thank you, and good morning to all of you. And a special thanks to the State Secretary Paula Lecky, the Permanent Secretary Päivi Salamäki, and of course the Secretary General Vesa Valtonen for the warm welcome and also for the, I think, very important basic information we have received so far. I think this gives us a first insight into the challenges and the things that we will find in the Finnish system. As you know, we have come here as the joint external evaluation team. My name is Tegnell. I'm from the Public Health Agency in Sweden. And I'm joined by my colleague from WHO, Tegnell Kandel, who is going to be the co-leader of this mission. And I know we are both very excited about being here and getting to know the Finnish system and to have good discussions around that. I would like to start with acknowledging, of course, the lead of Finland in this way, not only in putting together this very extensive and very good self-evaluation report so far, but also, of course, as a country that's been leading the process of the JEE all the way. And that, of course, means that it's a special privilege, but also a special challenge to be here and have this discussion with one of the founders of the system. And I think that's going to be very interesting. We are going to use, as you know, a peer-to-peer collaborative process. And we will use this to jointly assess the situation in Finland based on your report and these 19 technical areas that we're going through. And my colleague will go further into the detail of those 19 areas. We will, of course, follow the report, but there is also a multi-sectorial team I'm joined with here, and I'm sure that we can add experiences from other places and from our own experience to that, and out of that develop both the scores in the different areas, but also priority things that can, even in Finland, where the system already is so well developed, maybe serve to make it even better. I really like the Finnish slogan for the 100 years, together. I think together is significant on many things that we are working with here today. It's, of course, significant for Agenda 2030 in many ways. It's also significant for preparedness in general, as we heard already repeatedly, especially in small countries like Finland or like Sweden. This togetherness is very important. And I think together is also can be a good word for the joint evaluation exercises we do, because it's very much about doing this together. The team from several different countries and the Finnish team, and I'm really looking forward to taking that forward further. This exercise will assess the capacity in this country to prevent, detect, and not least rapid response to public health threats. And it doesn't matter if those are natural or deliberate or accidental. The system should be able to take care of them without any cause for that. And this is also, of course, the basic requirements of the IHR. And Nima will tell you more about the background to IHR, but this is the foundation and the platform where we can develop this togetherness I've been talking about. This process is a joint evaluation exercise. It's built on many similar exercises with peer reviews in many different areas. But I think it's unique in its way that it's really covering a very wide spectrum of different agencies, different departments, different ministries, and different stakeholders. And that's why it's evaluating, I think, countries in a new way. That's going to be very useful for all of us to do. And by now, the JEE also has a broad international support, which means that it also is a way of building a network, because we all know that health security is never going to be the challenge only for one country. It's always going to be the challenge for all of us together. And I think that's why it's also good that we have a team here from different countries and all together these JEEs with the networks it forms will also form an important basis for networks we can use also in the time of crisis. The exercise will build on the very extensive and very thorough self-evaluation report that we received already, and we are very impressed with so far. And we will use that as a basis for going through these 19 different areas. And we all think that we can add things from our various experiences in the team, and that together will give us a basis for the scores, the additional areas that can be developed in Finland, and we can use those together to form a report. We will end this week on Friday and give you some basic ideas on where we see that things can be developed further. And we are sure that in a team we can develop a report and get it back to you within a few weeks after that as a first draft. But of course this is a challenge. This is a lot of things that we're going to need to go through. There is a few hundred pages of reports so far. And I hope that we can all get together and support each other in keeping the timeliness that we've done so far in this, because I think it's going to be a major challenge to get through all of this in the time we have allotted. But I'm sure with the help of our experienced team and with the help of our Finnish colleagues that we can arrive at that, and we can develop interesting discussions during this week and get together and give you a good report back on Friday and develop it further into a written report that I'm sure is going to be useful for Finland in the further development. We already heard that you are developing new plans and new structures in several different areas, and I'm sure this is going to be a good basis for that. Thank you very much.